So, good morning. And again, I thought after 205 days and 30 weeks later that we wouldn't still be doing this. But there's reasons today. We had to set up the press conference, and we'll get into a lot of it. But today marks 205 days. We've completed 30 weeks, and 29 weeks, and we start the 30th week tomorrow. Start this on March 12th, and we continue this long and difficult journey every day, working together on top of the COVID-19 crisis, what's going on around in the county and around the world. So we're dealing with an economy crisis and dealing with how do you reimagine the workforce, continue to deliver the good services that we do in these times of needs, and people are going to need more now than ever before, and try to do it with that less money, with federal money being cut out, state money being cut out. And it's a question Liza and I always have about the health department, and people really see what they've been doing now, because again, it was one of them unnecessary evils, I'll say it like that, that people don't realize the work the health department does day in, day out, around 7 days a week, or around the year, and every day to protect the people of Albany County. And and we need them more now than ever. And then you find out they're cutting money, and then, well, we're like, we need this service, we need to keep these people out there and continue to do it. So it makes it tough. But what makes it even harder is the 134 people that we lost in Albany County to this COVID-19. And sadly enough, today I have to announce we lost someone else. It was a man in his 70s with underlying health issues, and my condolences and prayers go to the family, to all the 135 families, because again, it's difficult. It was more difficult in the beginning because you couldn't bury the person the right way. You couldn't have that last church service the right way. But again, it's still tough. And as people sit there and they think that it's not there, or I swear I had a dime for every time. If I get a dime for every time someone says this is going away November 3rd, I can close my budget without a problem, because it's not going away. And Dr. Whalen will talk about that. But as of today, we have 3,010 positive cases of the coronavirus in Albany County, 967 people under mandatory quarantine. It's an increase of 28 positive cases overnight since last night. We had 15 new positives yesterday, 264 since our last press conference on September 17th. Think about that, 264. 144 have been associated with UAlbany. Of the new positives for today, we also know 17 had close contact to positive cases, 2 report out-of-state travel, 1 healthcare worker, and still we had 8 don't have a clear source of infection at this time. Among the new positives today, we know 10 have been traced back to the University of Albany. So as of today, we have 12,596 people that have now completed quarantine, and of those, 2,912 tested positive for the virus and have recovered. That's an increase of 22 recoveries since yesterday. There are still 4 people hospitalized, and that's, as you know, in the control rooms, which we talk about is the hospitalization rate. That's one thing General Murphy brings up all the time, and we focus on. So 4 people hospitalized with a hospitalization rate of 0.16% of those who have tested positive, and the rate was 0.16% yesterday. We have 1 patient currently in the ICU, and yesterday that number was 0. So it's pretty much the lowest we've been in a while, so which is all good stuff. But it's still there. The virus is still there until we get a vaccine, and get that vaccine out to people. It's going to be here. And one of the things that has been good is the fact that people are wearing masks. And the flu season, hopefully we won't get hit as hard this year. I think in Australia it went through there, and it wasn't as bad as last year, because I'm hoping with people wearing a mask, coughing into their arm, cleaning their hands, staying 6 feet apart, getting the flu shot is going to keep these numbers down. But time will tell. Time will tell. Over the last 5 days, there's been an average of 14.8 new positive cases each day, and before that was 13. I know a lot of focus has been on the University of Albany. There's a lot of discussions I had with Mayor Sheen, Chancellor Malatras, and President Habidant Rodriguez, and we had to figure that out. And it's not easy with all these kids coming back to the area. We got a lot of major universities, not just here in Albany County, but surrounding Albany County in the Capital District, and how that was going to work going forward. Albany County had the 32 daily positives. 27 were linked to university students. But more recently, we're seeing a percentage of students that make up our daily total decline. So it went from 84% back in September 18th to 61% a week later to just over 13% yesterday, which is a huge decrease. And what's that fold into? It's like we've been saying to the workers, the non-essential workers that have been staying home, reimagine, look at what the workforce was going to be. Same thing with the universities, and my hat's off to the new chancellor and to the president and to all the presidents of the universities here. And they did a good job, but the students had to learn, right? It's like when you teach your kids new things when they're little, and you got to remind them, just like we're trying to bring to everyone about wearing the mask and coughing in the hands. So the students came, got a little freedom, and some of them did do the right thing, so that number went up. Now I think they're getting it, and my hat's off to the university president, to the student body that's really been enforcing this, to the young adults that go to the University of Albany and Siena College and Maria and St. Rose and Sage and pharmacy and law. I could go through them all, but they're all doing a great job in Hudson Valley too. To President Ram Sammy up there, who's doing a good job. Kids are getting it. So that's why we think, and we hope, I'm not saying we're hoping, that's why the numbers are going down. And to, Mayor Sheen and Chief Hawkins, to their outreach to the community in Pine Hills neighborhood to make sure that they're educating the neighbors and the residents and students to be good neighbors. It takes a partnership. Doesn't take pointing fingers. It doesn't pay, it does me no good to sit here and point fingers and blame someone else or say this is why it happened. We got to work together because the people that we represent deserve it more now than ever. And we can do it doing it together. We need people to do the right thing and continue to do the right thing. We need people to step up and remind other people about what's going on. One of the things, it's nice that we've heard from customers that want to thank the Chipotle employees at Stuyvesant Plaza. They had a large group outside, and they came into their restaurant, and the workers actually made sure they were doing the right thing, got them socially distancing. That's what it's about, but being in it together. And I'll say this, though, and I'm glad that this customer took the time to send us an email to say what a great job they did there at Stuyvesant Plaza. But also I remind people, if people get combative, you just got to walk away. I can't tell you how many times I say to people, pull your mask over your nose, and some people just give me that nasty look, and some people say thank you, but again, it's a different world, and people are dealing with this new world differently than anyone else. So you just got to remember that. Take a step back, take a deep breath. I've said this 1,000 times now. It's a marathon, not a sprint, and we'll get through it together. One of the other things we've gotten some complaints on was the Blue Bank State Park in Washington Park, the skating park there. We've gotten some complaints online and through other people. Talked to, our offices reached out to Mayor Sheen. We addressed it moving forward. But again, we want kids to go out and use the skate park and do the right thing. But you got to socially distance and stop congregating. But again, that stops the spread. So I want to thank the City of Albany for them and stepping up and doing the right thing as always. Just remember, wear a mask. Cough into the arm. I know I keep saying it, but I just got to keep saying it. 6 feet apart and continue to clean your hands. We also want people to get tested whenever you have signs or symptoms. There's plenty of places to go now. If everyone notices they're popping up. I've had people call me and said, "Hey, I heard this new site," and I'm like, "I don't know, didn't hear about it." So we checked it out, and they are getting really, really good with all the testing sites around the county. There's no reason why you can't get it done. But again, if you don't have insurance, we're going to cover it. So if you go to one of these sites, please, by all means, inquire that if you don't have insurance or what your co-payment is. Albany's free. The state of New York hasn't charged a dime. Thank you to Governor Cuomo and his staff. They haven't charged a dime on any of this. But you have to make sure that you don't get hit with a bill. I've gotten some claims. People said they had to pay $100, and I'm like, well, listen, if you come to our sites, you don't have to. Albany, you don't have to. The other thing we're getting is what kids, a lot of parents want to know about kids, especially now because sports are back, about travel teams, which I will say this again, there's no travel allowed. There's no even going into another county playing basketball or any other sport. I know it's going on. Can't stop it. You try. I know the parents get mad. I know they want their kids to feel some sense of normalcy. But please, this is how we're going to stop it. This is how we're going to stop the spread from going around. So they are offering at the Uptown campus testing for kids who are at least 2 years of age and older. You can schedule an appointment there at 188-364-3065. Our Whitney Young, again, great partnership with Whitney Young by appointment now, 518-465-4771. And now there's some CVS stores have drive-through testing. The location, some of them are at 885 Central Avenue, 3916 Carmen Road, and they'll do testing for 12-year-olds and at them sites and them two CVS sites. So, and also you can go to www.cvs.com for COVID-19 testing to set up an appointment that way too. We also have Albany Med urgent care locations offering the nasal swab, which some people love better. I don't know if you've gotten either one done, but the nasal swab one, I think that's the easier one, right? You can explain that because I don't like either one of them. But antibody testing for children at multiple locations, along with Priority 1 in Gilliland. They're also doing the antibody testing, and that number is 518-867-8040. I will say this question for Dr. Whalen because we continue to get this. People are like, well, you had COVID-19, got the antibodies. It's not proven how long they stay in your system and if it stops you from getting it, but we continue to get them questions. So just because you had it or someone in your family had it, you're not immune from getting sick, but I'll let Dr. Whalen talk about that. But also, please, you can also, for rapid agent testing in Albany County, Central Medical Urgent Care on Central Avenue, and Care Physicians in Latham both have it for tests for children. Walgreens on Holland Avenue gets back to you within an hour, so I know, but you have to make the appointment the day before. So people that need to get a rapid test right away, that's where I would suggest you go and get back. They'll get back to you within an hour to 24 hours. For adults without kids, the Rite Aid in Colony, you need to go online at riteaid.com to make an appointment. And again, I just said about the Walgreens and the rest of it. But Dr. Whalen.
Good morning and thank you. So there's a couple of things that I wanted to address this morning. The first is that we are starting to see a little bit of an uptick in cases. And I know throughout the summer we have been very carefully monitoring, and there was a concern that there would be a second surge of COVID in the fall. I don't know yet whether what we're seeing is constituting a surge, but it is constituting a caution. So it's important for people to know that COVID is still out there. There is still transmission in Albany County, and people are still at risk. So the behaviors that we have advocated for since the beginning of the outbreak, including social distancing, wearing masks, washing your hands, remain very important. And in addition to those guidances, it's also important for people to consider whether they need to be out and about. I think that at the beginning when we were all involved in the shutdown, people were staying at home. And of course, people became tired of that, understandably. And when we started to see less cases in the summer, people started doing things like having gatherings or going into spaces where there may be crowds of people. And I would urge you to give this consideration on a day-to-day basis in terms of what you need to do for yourself and your family, and try to avoid situations where there are large crowds. And when you cannot avoid those situations, to make sure that you're wearing the appropriate protective equipment and really being careful with hand hygiene. That's the first thing that I wanted to assert. The second thing that I wanted to talk about was the flu season, which is upon us. And, we're very concerned about the incidence of flu at a time when we have so much concern for COVID. There are some symptom overlaps, and the flu shot is the best thing you can do to protect yourself from getting the flu. We have seen a lower incidence of flu cases in the southern hemisphere during COVID, and that is likely because people were staying at home. But that does not mean flu isn't out there either, so we encourage people to get flu shots. They're widely available. I've had my flu shot already this year and encourage you to do the same. This will ensure that it will work towards the effort of decreasing hospitalizations that we see every year for people that get the flu, so that our hospitals can retain the capacity for surge that we may need should we start seeing more severe cases of COVID. It is a proven strategy, and it is something we advocate for every year, but this year it's more important than ever. So please reach out to your provider or visit a local pharmacy, or you can call us at the health department to schedule a flu shot. It's very important this year. I wanted to also mention that yesterday the governor launched a tracking and tracing app that I would encourage people to look at and consider downloading. I've downloaded it myself. What this app does is, via Bluetooth technology, enables awareness of if you have been in close contact, which is closer than 6 feet for more than 10 minutes with somebody who's been diagnosed with COVID. And it is a tool in our contact tracing armamentarium that hopefully will help us with the work that we do. As all of you know, we continue with our daily work of contact tracing and case investigation for every single positive case in Albany County. We are working on containing cases, and particularly where we see clusters of illness, so that we do not see further transmission. This is work that we have been dedicated to since day one, and I'd encourage people to look at that app and download it as an additional tool in our armamentarium. Finally, I wanted to mention that yesterday, the New York State Department of Health issued a K through 12 toolkit for schools. This is guidance that we have anticipated for weeks, and we were very pleased to get it. We have a conference call this afternoon with the state to go over this guidance. It has been distributed to our school superintendents, principals, and heads of school in Albany County. And yesterday I received a reach out from one of the superintendents and requested a conference call with all of them next week, and I intend to do that to provide further guidance and education. The schools have been great partners. They are all working very hard to ensure the safety of their staff and the students and the families that they serve. I applaud them in their efforts. It's been a steep learning curve for them, and they all are very invested and involved, and I look forward to continuing to do that work with them on a daily basis going forward.
Liza, thank you too, and that app is pretty cool to download it and check it out. It doesn't give up your information, so people know about the privacy thing. It was a good thing the governor did with it. So that was one of the questions we had. People are like, well, they're gonna know who I am. Just like Dr. Whalen said, it lets you know that you had exposure to somebody for more than 10 minutes, and it goes back to the DOH, I believe, and then DOH on the health side would notify that person that they were exposed to somebody and that they should get checked. So it's not giving up your privacy or who you are, so keep that in mind. So some of the things, just switching gears a little bit, I know nursing homes have been the topic since the beginning of all this, what's going on. But I want to highlight some incredible award that our nursing home has received. Shaker Place Rehabilitation and Nursing Home just received the American Heart Care Association, presented us with the Silver National Quality Award for Achievement in Quality. which is pretty cool because last year 2 years ago I think it was, we got the bronze award. So we're on our way to gold, and I just wanted to say thank you to the workers at our Shaker Place for everything they're doing, not just for our residents that live there and make it their home, but to the quality of care and what you're doing in that facility. So again, it's not going unnoticed what's going on. So please, we look forward to hopefully down the road getting gold, but it's great achievement to the workers that are out there every day. I also want to express my appreciation to Donna, who reached out to us to thank Shaker Place staff for taking care of her mother over the last 3 years. She wrote us an awesome letter and thanked the staff and everything like that, especially when she hasn't been able to see her mother for the course of the last couple of months. And it's been difficult for everybody, not just on the workers, but on the families. And thank goodness we're finally getting people to reconnect with their loved ones, safely get reconnected with their loved ones and continue to move on. One of the other questions that I did receive, every school child in the city of Albany got a card from the state of New York, a SNAP card, and basically it was $412 on each card for kids that missed their food from March to June of last school year. I got a lot of questions. I'll say to parents, it's not a health card. Don't throw it out. You better read it. It's long. Two long letters come with it. There's a PIN number you have to go on to dial into the state, and there's guidelines on what you can spend that money on. It comes from the federal government through the state. I know we did, through Feed Albany and a variety of other organizations, and I know all the school districts around the county got breakfast, lunch, and some dinners to students. But this is money from the federal government specifically for programs to feed children. So each Albany, I will say this to your parents, to the city school district kids, each one of your kids got a card in the mail worth $412 that can be used at any grocery store. Can't be used on fast foods, can't be used on a variety of other restrictions, has to be meats and stuff like that and different stuff. When you check out, it will tell you what it will cover and what it won't, but you can go online and look at it. So to the parents that threw them cards out, I don't know what to tell you, but it's not an insurance card. Please read it, go online. It had to be for the fact that when the school was shut down, they didn't pay this to the school districts, and the state passed it on to the children. The ID card comes with your child's name on it. It's a generic date of birth and a PIN number, and the parents can use it. The kids don't have to be there to use it. So just again, each one of them cards, as far as the ones we've been checking, are worth $412. So there you go. And also, I want to say, if you need mental health, it's available 7 days a week still, and I want to thank Dr. Giordano and his staff that have been so awesome since day one. We established this day two, I should say, because people do have issues, and again, we handle things differently. People's stress levels, people's the way they feel or think about something. So I will say this to you, please call that number. They're available from 8 a.m. to 5 p.m., 518-269-6634. We have the 24-hour sexual assault hotline number, 518-447-7716. And as always, the 211 in the New York State hotline number is always up and running. The world's changed around us. We're going to get through this. It is here, people. It has not gone away. It's not going to go away. I think it's, hopefully somebody out there will correct me. I think it's 33 days to the election, maybe 32, somewhere in there. It's not going away, 32 days. If you get your flu shot, please remember, you may have a reaction to it. You should get checked just to be careful. Someone in my immediate family got the flu shot, thought it was the flu shot, and it was COVID-19. And, unnecessarily exposed other people because they just thought it was just a reaction to the flu shot. So please be careful, and especially getting the flu shot. It doesn't mean you're going to have a reaction. It means it could just be a normal reaction. Actually, that was the question I was going to ask Eliza. It could just be a reaction to it, and but again, I think it'd be safer than sorry to just get a quick test and make sure that you're okay, because you're going to see some of that. But again, my prayers and condolences goes out to the family that lost the 70-year-old gentleman last night, and to the other 134 people in Albany County that passed away.